Unicef has made worrying findings in relation to HIV infections among youngsters. 320,000 children and adolescents were infected with HIV in 2019. The group has also found the COVID-19 pandemic has had a major impact on HIV treatment and prevention services. On this World AIDS Day, let's get more context from Lebogang Schultz, UNICEF South Africa's AIDS specialist. Thanks for your time, Lebogang. Appreciate it. So you've come up with a shocking stat, right? Approximately every minute and 40 seconds, a child or young person under the age of 20 was newly infected with HIV last year, bringing the total number of children living with HIV to 2.8 million. Does that mean we're nowhere close enough to getting the fight against this virus right?
Thank you for inviting me to this interview. Yes, we've made significant progress over the past few years. However, for children and adolescents and young women, we are still lagging behind in terms of ensuring that they are part of the discussions around improving the HIV program, and they're also part of the debates that are ongoing regarding HIV. Although AIDS-related deaths have declined among children, HIV is still the third leading cause of infant mortality in South Africa. So we still have to make concerted efforts and focus on children and young people to ensure that we reach the targets and we reduce HIV-related mortality and put them on treatment.
Yeah. So let's talk about that a bit more, because you're also warning that children are being left behind in the fight against HIV. Elaborate on that for us. Give us the context.
One of the examples is that South Africa signed to the global strategy of reaching 90% of people living reaching 90% of people with HIV testing, putting 90% of those that are infected on treatment, and ensuring that 90% of those that are on treatment are virologically suppressed. However, with children, it's a different picture. We are only testing about 80% of children. We are only putting about 74 of those that are infected on ART treatment. And only for those that are on treatment, only 64% are virally suppressed. And this has been a persistent issue over the years, especially with regards to children.
You also found that the COVID-19 pandemic interrupted HIV treatment and prevention services. How so?
Yes, it did interrupt the services. For example, in Gauteng, it has shown that around 19% of people infected with HIV missed their treatment, and that number includes children. So we can see that overall, services for children have been impacted. For example, the immunization services, where we find these children, where we test them, where we ensure that they are also on treatment. Also, the prevention services, which are mainly outreach. People were not able to go outside and look for the children and provide preventative services due to the COVID-19 pandemic. So that has severely impacted on the treatment and also reaching those that are in the communities. I think one thing that we have to make sure is that this COVID-19 pandemic does not reverse the little gains that we have done, and we continue to work hard to ensure that we reach the children, we reach the adolescents as well.
All right, thank you for your time. Lebogang Schultz, UNICEF South Africa AIDS specialist.